Hi, everyone. Thank you so much for joining us. I know we've had a few weeks off of our Facebook Live series. I hope you all had a wonderful 4th of July celebrating time with your loved ones and friends. We're back here today. Again, my name is Ethan Jordan, and I have the pleasure of supporting Odyssey Behavioral Health Care and all of our programs. And I'm really excited today to spotlight Lifeskills, one of our programs based in South Florida, and the lovely Amanda Bassos of Lifeskills South Florida, and Dr. Michelle Quilter, the leader of Lifeskills DBT program. So Amanda, Dr. Quilter, I'll turn it to you.
Thanks, Ethan. And thank you again, everyone who's joining us on this Facebook Live. It's great to have you back. And we're excited that you're a part of our Facebook Live event today. So again, for those who might not know me or know Lifeskills, again, my name is Amanda Bassos, and I'm part of the business development team with Lifeskills South Florida. And if you're joining us for the first time, Lifeskills is a dually licensed treatment center where we've been providing care for adults presenting both with complex psychiatric disorders and substance use disorders now for 30 years. And we offer a full continuum of care from residential treatment to outpatient treatment, including PHP, IOP, and transitional housing as an option. Now, given that we can serve adults with clinical complexities, we offer several evidence-based clinical pathways to support the clinical care that we provide. And those pathways are cognitive behavioral therapy, cognitive remediation therapy, trauma, chemical dependency, and dialectical behavioral therapy, or DBT. Now, I'm excited today to introduce one of our licensed clinical psychologists, Dr. Michelle Quilter, who's our director of DBT programming at Lifeskills. She's a DBT Linehan board certified therapist, only one of 275 or so in the nation, and one of 8 in the state of Florida. Wow. And Dr. Michelle's also a certified credentialed alcohol and substance abuse counselor. So thank you so much, Dr. Michelle, for being here today, for offering to share with us some of your incredible clinical knowledge and expertise. We're excited to learn a bit from you today. So let's jump right in. I know one of the personality disorders that we sometimes see at Lifeskills is antisocial personality disorder. Can you describe to us a little bit of what that looks like and how that presents in a client?
So with antisocial personality disorder, the main thing that would be noticed with family members or friends would really be a difficulty with empathy, really at the core of antisocial personality disorder. Usually individuals who have antisocial personality disorder tend to engage in some illegal activities because they don't conform norms of society. So when it says, a lot of times people get it confused, like antisocial being like not social, but that's not what it means. It means anti-society. So antisocial. And really there's a disconnect between being able to see how other people are feeling and being able to respond to that in an appropriate way. So a lot of times the individuals with this disorder will have significant histories of violence or acting out towards other people without concern for how that's affected them. Or family members might say that as well, that they're just, mean spirited, that they don't think about how other people feel in situations. So a lot of times those individuals won't seek treatment on their own, usually mandated through the court or they're mandated through their families. And it's usually because they have other co-occurring issues. Most of the time it's an addiction that will get them into the court system or into treatment. So once they're here and they're being treated, it's really important to know if they have antisocial, because there's a different approach to take with individuals with that personality disorder versus someone with addiction without a personality disorder.
Wow, great overview and great description of how that presents itself. So based on just that presentation, what are some of the best therapeutic modalities in place to support someone with this type of presentation?
Well, historically, there has been very little research to show that any treatments are effective.
Mm-hmm.
The most recent research has said that at times some cognitive behavioral therapy can help. Some dialectical behavioral therapy, that seems to be at the forefront right now, the DBT as being helpful with that, and some medication therapies. So most of the time antidepressant medication, for a couple of different reasons. One, there's a lot of impulsivity. And so antidepressants can sometimes slow the impulsivity. And also because individuals with antisocial personality disorder don't experience emotions the same way that other people do, they tend to feel pretty bored and depressed most of the time. So they have trouble feeling empathy, but they have trouble feeling excitement, happiness, pleasure also, which is, difficult for them. And then that adds to the chronic seeking of risks and like drugs and things like that.
Absolutely. That makes sense. When you describe it that way, and how often we see our families that don't have that knowledge, not being able to understand, where this is coming from for the individual. Yeah. Very helpful. So in terms of providing the DBT care at Lifeskills, what does that look like? How do we provide that to support our clients?
So the DBT, so typically on an outpatient basis, DBT is 2.5 hour once a week group. Mm-hmm. So at our IOP level of care, that's what we do, is the traditional 2.5 hour group once a week. What we did was we modified the treatment schedule for residential so that it's a 13-week curriculum rather than the typical 6 months or a year curriculum. So we can fit everything in for a client who stays 90 days, which is our recommended length of stay. So if a client's here for 90 days, they'll go through the entire curriculum once. And then if they step down to PHP, they'll get to go through that again. And what we've done is we've broken down the group. Rather than having 1 2.5 hour group once a week, we have 2 1-hour groups so that it fits into our residential schedule, because most of our groups are an hour long.
Wonderful. So helpful to hear. Now, for an individual or a family, for that matter, who's looking to potentially explore care for their loved one with antisocial personality disorder, whether they recognize it or not just yet, but they're, kind of on the fence of what the next step looks like, what advice might you have? What helpful insight might you be able to give for someone who's looking at those next steps to take for healing and recovery?
Well, I would say a couple of different things. One, somebody who has that disorder, they don't always do well with being forced into treatment. So even though that is how they find their way to treatment many times, it's not particularly helpful to be forced into treatment. So if they can buy into the treatment in some way, that would be best. So if you can get them to agree to outpatient groups or get them to agree to see a therapist or anything to where they can buy into it. And then if they need to increase the level of care, of course, then they would. But so that they're interested in making some kind of effort, because with antisocial personality, they need to feel like it's in their best interest to do whatever the task is, or they're not going to do it. Or they're just going to do it and not gain anything from it, just to pacify whoever's telling them to do it.
Well, very helpful information, Dr. Michelle. Thank you so much for taking the time to share that with us. I hope this was helpful to our listeners. I know it was for me. Always great to have more of an understanding behind, the presentations that we often see. So if anybody has any questions about Lifeskills South Florida, about our DBT programming, about antisocial personality disorder, certainly feel free to reach out to myself, to Dr. Michelle. We're happy to answer any and all questions that you might have. So thank you all. Thanks, Ethan.
Thank you all.